We're at a very exciting time when the Genome Project, which I think was frequently depicted as a race to the finish line, was really a race to the starting line. And the starting line was to begin to use the kind of information that comes out of the Genome Project to actually help us to better diagnose disease and better treat disease. We're now over a decade away from the completion of the Genome Project, and to a degree that most of us thought we wouldn't see during our career. We're already bringing the fruits of the Genome Project and genomic medicine to the bedside. So this is exactly the time when we need to be sure that we inform both the public and practicing physicians about the opportunities that are already presenting themselves by virtue of bringing genomics to the bedside, both to make it possible to better diagnose disease in cases where, in many tragic situations, people have known for years that there was something different about them and that they weren't well, but we didn't have answers, and we can now provide diagnoses. And hopefully, and increasingly, to better treat patients, to use their genomic information so that what we can do is tailor their therapy to the point that we can maximize the effect of drugs that we want to work and avoid the adverse drug reactions. So this is the perfect time, and with a really surprising degree, we're bringing genomics to the bedside. We're doing that here at Mayo. It's happening in other academic medical centers, and I think it's a perfect time to have a conference where we can give a progress report about where we are and what this means in terms of the care of patients. What we're seeing at places like the Mayo Clinic is that we are eventually going to have genomics touch every patient who comes here to receive care in some fashion or another, and their physician, so that their physician will have information that my generation would have thought was impossible in terms of trying to tailor the therapy. So that what happens today, let me give you a concrete example. For some drugs, the drug is a very good drug, but some patients can't take that drug because they're at risk of very serious adverse reactions. What we're currently implementing into our electronic medical records at Mayo and elsewhere are alerts that go to the physician when he or she writes a prescription, and it's for a drug that genetics might help to tailor the therapy. Then an alert will come up on the computer screen for the physician saying, that possibility exists, would you like to order a genetic test? Now that's only a way station on where we're really going. Where we're really going is to have that genetic information preemptively already in the medical record, so that the alerts would say, your patient will be unusually sensitive to this drug. You might want to consider another drug, or you might want to lower the dose of the drug. That's already happening. In our individualized medicine clinic, we already are seeing patients who come from across the country and across the world who are seeking some diagnosis, and they know that they have an illness, they just don't know what it is. And to a surprising degree, by using the modern genomic techniques and sequencing at the current time across the whole genome, then, we are able to give some of these patients answers, not all of them. I don't want to give that impression at all. So that's already happening. And increasingly with cancer patients, we're hoping that we can anticipate ahead of time whose cancer is developing resistance to therapy so that we can intervene early before the disease spreads and begin to treat them with a therapy for their cancer that's tailored to the unique genomics of their own cancer. All of that is already happening in places like Mayo, and will soon be happening across the entire country at a pace that really is quite surprising. Nobody has all the answers, and for right now, we're all pioneers in learning from each other together as we move forward. So we're really looking forward to the conference because of the exciting faculty that we've managed to attract here. They're coming here to learn from each other, too.